Hello and welcome to another episode of Let's Talk Health. Today's session is on care for newborns, and to discuss this we have with us Dr. Kiran Kumar, Senior Consultant in Neonatology and Pediatrics at Citizen Hospital, Srinagar, Hyderabad. So, good evening, Doctor. So, before we start with our question, I would request you to give our viewers a glimpse of your expertise.
Hi, Andy. I have sort of trained in Hyderabad. My medical graduation was in Warangal, and then my post-graduation was in Hyderabad. Then I went to UK and I trained there and I worked as a consultant there. I think the total period was about 12 years, followed by my stint in Abu Dhabi where I worked for 4 years. So that's my expertise, and then I'll come back to Hyderabad.
Okay. So, we'll start with the question.
Sure, yeah.
My first question is, what is the golden hour for a newborn baby?
Golden hour for the newborn baby is the first hour after birth, in which the child is adapting to the new situation after birth and adapting with the breathing, regulating the heart rate and regulating the temperature, and also preparing to feed. And as for the mother, again, she's also getting to know the child and also having skin-to-skin contact, and then the first meeting with the baby, and also her body is also preparing to get to know the baby and feed the baby as well. So this is extremely important to allow the smooth transition after birth so that the baby and the mother can bond well and establish a feeding schedule.
Okay. So, my next question is, Doctor, what are the medical screening tests required for a newborn?
All newborn babies have a standard sort of test for screening after birth, which mainly involves in the first day or in the first few hours, we do a general physical examination of the baby where we check the baby from top to bottom to identify any physical problems. Then followed by the regular, screening for heart problems. So you do a congenital heart screening test, which involves checking the oxygen percentage and also other things. Then the third one is for newborn blood spot screening, we call it. We look for common blood conditions like thyroid problems or hemoglobin problems or other thalassemias and other things. And the fourth one is a newborn hearing screening test. This is all the standard sort of tests which we should do for all newborn babies delivered.
Okay. So, my third question is, Doctor, what kind of care is required for a newborn during the first few days of hospital stay?
Yeah, the care for newborn has two aspects in a hospital delivered child. One is the medical team which is looking after to care for the baby. The other thing is the more important is the family care. From the medical care point of view, the doctors and the nurses will monitor the child mainly for jaundice, weight loss, feeding, and any other breathing problems which can crop up after birth. And then they will do this right from the day one till discharge. From the family point of view, it is important that they care for the feeding, on establishing the feeding, then also monitoring for any other concerns like whatever they have, like breathing problems or any physical concerns they have about the child. They should discuss with their doctor or the team which is monitoring the baby and, look for any issues.
So, my next question is, Doctor, what are some of the common medical conditions seen in a newborn after birth, and what are the treatment options available?
Some of the conditions which we see fairly commonly relate to breathing issues. That is the most common things we see in newborn children. It is a sort of a thing which we see in the transition phase. Some children may require a little bit of help with the breathing, like oxygen requirement, for a few hours, suppose. Or some of them, if they have more breathing problem, they can require longer. That is number one. Then the other thing is about the jaundice, which we all know it can happen in newborn babies, which the doctors will monitor until the time of discharge and after discharge as well. So these are the two main issues. And sometimes we may hear an extra noise in the heart, which we call it as a murmur. Parents should not be alarmed by this sort of thing when the doctor mentions it's a heart murmur, because most of them, they end up as having a normal heart, but they have an extra noise. If in case the child has any other problem, the doctors will talk to the parents and then decide what else we need to do, like doing an echocardiogram or checking the blood pressure and oxygen percentage in the blood to identify any hidden problems. So these are the main three issues which we...
So, my next question, Doctor, what types of vaccines or shots are given for a newborn?
In India here, we give three sorts of vaccines after birth. One is the polio drops we give by mouth. The one is the BCG vaccine, which is given the left upper arm. And then the third one is the hepatitis B vaccine. These are the three things which are given for all babies.
My next question is, how does the family need to take care of the newborn in home?
Yes, it's a very good question. I think the emphasis should be for the family to establish feeding. That is the number one. Then I think the other issues will be about jaundice, any weight loss, any breathing difficulties, or any other concerns which the family may know, and specifically about skin care also, because that also is an important aspect, and lots of parents are worried about what is that sort of care. Generally speaking, we tell the parents not to bathe the baby until the umbilical cord drops off. Only sponge bathing should be done. Post that, then you can bathe the baby. Roughly, you can say about alternate days or even once in 3 days also is acceptable, depending on the weather conditions and the place you are born. Sometimes it is also that you may not need to bathe the baby every day in the first few weeks or few months. That also is that.
Okay. So my next question is, doctor, so why do newborn babies get affected with jaundice?
Jaundice is an issue in the first week and also in the second week, and thereafter it goes down. The main reason is that newborn babies are born with a high red blood cell count, and when these red cells are broken down, the yellow jaundice pigment is produced. That is the reason for jaundice. Now, the liver takes at least a couple of weeks to mature. So until then, the jaundice needs to be followed up to the highest level and then following the drop also by the doctors. So parents need to make sure that they attend the follow-ups until the jaundice is resolved. So as I was mentioning, the jaundice, severe jaundice can cause injury to the brain and can damage the brain. So it is extremely important parents follow the doctor's advice to make sure the jaundice is coming down.
So my next question is, doctor, what are the most common feeding issues in newborn?
Most common feeding issues are, one is children bring up milk. We call it as regurgitation of milk, which is fairly common, but it is harmless. As long as the child is gaining weight, we can sort of wait and watch, and no intervention is required. That is number one. And sometimes the other feeding issues are not able to feed well from the mother's breast, and that also needs to be explored by the doctors to see what can be done. Then the third thing is about prolonged feeding also. Sometimes it can take long time to feed. Is the main sort of issues. And one final aspect is, if the child is not gaining weight, that also needs to be explored, because the child is not gaining weight, there is some problem with the feeding. So this needs to be explored.
So coming to the last question, sir, is it normal for newborns to gain and lose weight?
Yes, newborns lose weight in the first 5-6 days, and then they regain their birth weight by 10 to 12 days or up to 14 days. This is a normal sort of pattern, and we monitor the babies for the percentage of weight loss. If it is excessive weight loss, then the child can be dehydrated and may need help. So it is important again for parents to note and attend the follow-up.
So thank you, doctor, for your valuable time and inputs. So with this, we conclude today's session of Let's Talk Health. We'll be back with another episode next week. Till then, take care and be safe.